Hello and welcome to this Friday weekly webinar. Today to talk about holistic health through therapeutic self-reflection, we have with us Dr. Mayank Shukla, who is Professor Allied Health Sciences, Sharda University, यूपी। आपका बहुत बहुत स्वागत है सर इस कार्यक्रम में। We also have with us Communication and Documentation Officer of Murari Desai National Institute of Yoga, मोहम्मद तैयब आलम सर with us. आपका भी बहुत बहुत स्वागत है सर इस कार्यक्रम में। Now, as per the tradition of our institute, let us start the program with prayer. Om Sahanavavatu Sahano Bhunaktu Sahaviryam Karvavahai Tejasvinavadhitamastu Ma Vidvishavahai. ओम शांति शांति शांति। जैसा कि हमारे सभी दर्शक जानते हैं कि हमारी ये शुक्रवारी जो वेबिनार श्रृंखला है वो हमेशा 5 बजे होती है, जिसमें हमारे जो अतिथि वक्ता होते हैं हमारे दर्शकों को हेल्थ और वेलबींग से संबंधित विषयों के बारे में बताते हैं। उसी कड़ी में आज हमारे बीच डॉक्टर मयंक शुक्ला सर मौजूद हैं, जो शारदा यूनिवर्सिटी में प्रोफेसर हैं अलाइड हेल्थ साइंसेज में। आपका पुनः एक बार बहुत बहुत स्वागत है सर। आपका मैं मुरारजी देसाई राष्ट्रीय योग संस्थान की तरफ से तथा स्वयं अपनी तरफ से हार्दिक स्वागत करती हूँ, जो आपने हमारा अनुरोध स्वीकार किया और होलिस्टिक थ्रू थेरेपेटिक सेल्फ रिफ्लेक्शन विषय पर हमारे दर्शकों को जानकारी देने के लिए आज यहाँ उपस्थित है। आपका पुनः बहुत स्वागत सर। इसके साथ ही साथ मैं संस्थान के संचार एवं प्रलेखन अधिकारी मोहम्मद तैयब आलम सर का भी हार्दिक स्वागत, वंदन एवं अभिनंदन करती हूँ, जो कि हमारे इस शुक्रवारी जो वेबिनार श्रृंखला है उसके एक अभिन्न अंग है। आपका भी बहुत बहुत स्वागत सर, और मैं उनसे अनुरोध करूंगी कि कृपया कार्यवाही को आगे बढ़ाएं।
थैंक यू डॉक्टर वंदना। आप सबको नमस्कार। Respected Dr. Mayank Shukla sir is a professor of applied health science at Sharda University, UP. Dr. Mayank sir has a PhD in sports medicine and physiotherapy and MPT in the cardiopulmonary PT. He has been trained at the best hospitals, including AIMS, New Delhi. Sir has more than 18 years of teaching and clinical experience, along with international teaching experience at LTU, Sweden. Sir has 18 publications and 3 published patents. One of his paper is a part of WHO COVID-19 database. Sir's areas of interest are actinotherapy, cardiopulmonary, physiotherapy. With this, thank you, sir, for accepting our invitation and it's available time for the 119th weekly Friday webinar. The Friday webinar of Murarji Desai Institute of Yoga is quite popular event on social media platforms. Students, staff, and faculty of the institute. With these few words, I would like to invite our today's esteemed guest and a speaker, respected Professor Mayank Shukla sir, to elaborate upon today's topic on holistic health through therapeutic self-reflection. Sir.
Thank you so much, Tayyab sir. And indeed, it is my proud privilege to be present here on this platform and to be able to speak to all of you on this topic. Holistic health through therapeutic self-reflection. It's a very, very important aspect which is required at individual level. And it is going to be very, very important and beneficial for everyone because in today's time we have to reflect on different aspects if we want to maintain holistic health, which is a very wide aspect. So I would like to share my screen and do the small presentation about this topic.
Yes, sir, it is visible.
Thank you, ma'am. So, holistic health through therapeutic self-reflection. What is the concept of health? If we say the Vedic culture, it says samadosha, samagnischa, samadhatu, malkriya, prasannatmendriya manaha, swastha itya vidiyate. That means a balanced body with all its components, physiology, anatomy, and various aspects, how it has been described, and a balanced mind and spirit is health. However, WHO Constitution says health is a state of physical, mental, and social well-being, and not merely the absence of disease or infirmity. Here we clearly see that it is not just the absence of disease. So even for mental health, physical health, these aspects are applicable. Further, if we go to the different subcategories of it, then it is said that Triya Upstambha Ahara Swapno Brahmacharya Cha Sati. What are the three sub aspects of it? Are diet, sleep, attitude, and behavior. So now this is the concept, but what is the current status of aging and health in the world according to the WHO? Now it's a rapidly aging world population, and there's little evidence that older people today are in better health than their parents. That means despite all the technological advancements and more information and knowledge, further, the health conditions are not very good. And we all know that we are facing a pandemic from past 3 years. And the most common health condition in older age are non-communicable diseases. When it comes to health, there is no typical older person. Health in old age is not random phenomena, and ageism is also a biased thing like racism or sexism, where a aged individual is now considered he may not be able to do this thing or that thing. Comprehensive public health action will require fundamental shift in how we think about aging and health. Health systems need to be realigned to the needs of older population. And in the 21st century, all countries need an integrated system of long-term care. And healthy aging involves active participation of the government. Why I have taken aging? Actually, health is a very big area, and aging, like if we see swasth and dirdhayu hona, to have a long life and to remain healthy, these things go hand in hand. Now, what is holistic health? Holistic health, in my thinking process, it is a complete and comprehensive health. So, holistic health comprises of completeness and unfragmented picture of one's well-being and health. It includes multiple aspects like physical, mental, and social, and aspects associated with wellness and fitness, which is like emotional wellness, economical, spiritual, of individuals at different levels. Now, we need to understand that as an individual, I may seem very fit and healthy at my workplace, but I may not be actually that much healthy. And then maybe I may be having some issues. However, the thing picture, what is this picture? We say that a picture is equal to 1,000 words. So, what is the picture of holistic health? The picture of holistic health is that an individual is able to have completeness or wholeness, wherein if he is able to completely provide at the individual level, family level, at the occupational level, office, community, society, national, international levels. That means he is perfectly able to balance himself at various levels, individual at different levels. Like he should have good attitude and behavior, as we have seen. So how, like there is another Sanskrit shloka here which says that whatever is manifested by God and whatever is not manifested by God, both is complete. And even if you take that completeness out from that completeness, still it will remain complete. So the human health is something, daily we are doing something. Daily we are taking challenges at personal level. We are giving 100%. Then again, we should remain fit, fully fit. That is very challenging task, holistically. Because if I am giving 100% at my workplace, then I go home, I may feel tired, but again, I should be fit enough. Then again, I go to the community, I go to the market, I meet my friend, then also I should be fit enough. So it is very, very demanding. It has got multiple levels. It depends upon physiological processes and balance between one's internal and external environment. So now this is another thing about about our own country, where in 2021 the 30 high TB burden countries accounted for 87% of the new TB cases. So India is having number of such cases. The 8 countries, they're two-thirds of the total TB population, and India is the leading one. Now it's a very ancient disease, still we are not able to overcome. So there has to be holistic health. Though there are effective medications are available and programs are there, government programs are there, still this disease burden is there. Similarly, if we see polluted cities in the world, then many Indian cities are there at the top list. And this is again very alarming, because if we see as a human being, we have a body. This body is on the planet Earth. Planet Earth, in our ancient Indian concept, we consider our planet also as a living being, like Dharti Mata or Prithvi Mata. Then if our cities are polluted, and as human beings, if we are inhaling along with the oxygen various pollutants, then can we imagine to remain healthy holistically? This is a challenge. So we need to understand that holistic health is not only our internal environment, rather the concept of the health has gone beyond a human body, and it has gone to the environment of that person. What is the environment in which we are? Even if we are completely healthy, but if we are in a polluted environment, then also we cannot say that we are completely healthy, because we are having the adverse effect of being in the environment, because we are inhaling in the environment, we are living in that environment. It is just an example. There can be pollution everywhere. So this is another aspect. Now, what is therapeutic self-reflection and how it can help us in holistic health? Self-reflection is that process which takes us from the daily run, daily out of the mill run, and it stops, gives a comma, and it helps us to reflect on our attitude, on our self-reflective ability, on our conscience, which are the three important domains of holistic health. Like we have preventive and promotive approaches like yoga. They are very hugely popular because they have a holistic nature of intervention. Even if we have a medical surgical management, it is required to be supplemented with therapy and rehabilitation for various disorders and dysfunctions to achieve holistic recovery. So now here we need to understand that when we are reflecting on our health in a holistic manner and in a therapeutic way, we have to see what is our attitude, what is our behavior, what is our conscience, what is our environment, how sensitive we are to the environment, how sensitive we are to our body and to the environment in which the body is, to our fellow colleagues. And there are so many aspects which we can reflect upon. Now we have done a study here. This is a publication from that study during COVID-19. Self-reflective holistic health for university students during COVID-19 using a novel tool. It is published in the Journal of Higher Education Policy and Leadership Studies, Scopus Index. So during the outbreak of COVID-19 pandemic, the students were engaged in a self-reflection to overcome anxiety and the related disorders which were there. We had a questionnaire, we emailed them the questionnaire, we got the responses, we analyzed the responses, and this questionnaire-based engagement was done to make the students a self-reflective one in the challenge of COVID-19. So this is the questionnaire we used. We used 5 questions about attitude, 5 questions about self-reflection, 5 questions about conscience. And then there was a Likert scale and we did scoring. So in the attitude, diet, balanced diet, vegetarian diet, because COVID-19, it was well known. And then when we made the questionnaire, that time it was not so popular in the literature, but later on it became popular that non-vegetarian population was having some poor response towards it, because the origin of the COVID virus is from the non-veg food only, maybe. So the enthusiasm during the academic and official activities, exercise duration, punctuality with the exercise, belongingness to family and friends, this is attitude. How good they are. Self-reflection, what is the perception of the present? How do I perceive myself? What is my perception of my future? Can I justify my actions today comfortably? Or I feel that, I lagged there, I could have done that better, this is not good. Or do I have such kind of things like anxiety-related things? Can I relate to the things around me? What is happening? Or do I feel, what's happening? I don't know what's happening. So that is again something we have to look for. And what is my own feeling about my sickness? How many times I think I feel sick? Then conscience, if I take I have to, how much I give to others. What do I have a purpose? Do I meditate and pray? I donate, I go for charity, some spiritual work, social work. And then we combine all this data and then we get the diet and lifestyle, perception of self, spirituality, charity, and social work, all these things. And according to the score, we have an individual who needs urgent help, needs improvement, average but can do better, good holistic health, and exceptional holistic health. So the individuals who are self-actualized, they are not only maintaining good attitude, good reflection, helping the society, they are having good holistic health. They are blessed with good holistic health. So, so this is what is therapeutic. It's just an example. We can also do this through the engagement, face-to-face interaction with a healthcare provider. We can just sit in meditation and think about these aspects and take corrective action. We can go through these questionnaires, respond to the questionnaire, and then find out how it is for us. Various ways are there. However, howsoever we get to know those things, those ideas, which therapeutically allow us to take ownership, observership of our own health. So it is a self-reflection about the holistic health in a therapeutic way. It gives an opportunity to the individual to modify our responses to the stimuli. How many times I should respond, in how many ways I should respond. Should I respond peacefully to a challenging situation? Should I respond in an angry way, in a hasty way, in a calm way? So it gives, and then obviously the health also changes. As an individual, as a seeker of holistic health, this is the ultimate aim, to respond to the presented stimuli in the best way. If we can do that, there's nothing like it. This is one of the aspirations for holistic health. So now you see COVID-19 presented individuals, societies, nations, scientists with different options. How to develop the vaccine. Some people developed vaccine only against the few proteins. However, certain countries developed vaccines against the entire virus. Now there is a new variant every day. Initially Omicron, Delta, now there is some new variant which is recently very prevalent in US and in China. We have a threat to that variant. Now, in the holistic approach has always proved to be better. If the vaccines which are developed against the whole virus, they are still performing better than the vaccines which were developed against only few proteins. So whenever, as a scientific man, we have tried to oversmart the nature has always told us that you can't do it so easily. Now, even if we see today, in what is happening in Joshimath and all other places in Uttarakhand, there's a lot of landslide and large areas are under threat because of the thinking of the scientific thinking was such that they will be able to make those tunnels and all those things, but somehow it didn't work out. In the earlier times, we used to respect the nature. All mountains and rivers, they were all given very sacred position. But however, if we see holistically, the nature, if it was respected like that, then naturally the individuals, the societies, and the nations also will be safer, right? But however, it so happened that over a period of time, the respect and due recognition of the nature which was given in the Vedic Kals was replaced by industrialization, and the people started, stopping. They stopped giving that much of importance, and it happened long back. And maybe I'm not a very good authority on that particular topic, but still, this is a food for thought that we have to have a holistic approach towards our health, which not only include the individual but also the environment. So I'll just stop here. Thank you. Any discussion or any questions I would like to take?
Sir, some viewers have asked that how can we just tackle with our mental health and mental illness in this current situation of overstress?
See, one of the important thing is feeling of uncertainty, feeling of anxiety.
Yes.
So first of all, we have to take the right action. We should not take actions hastily. We should seek advice from the people who are more aware. We should remain resourceful. That means whenever we have a challenge, suppose we are staying alone, we are studying somewhere, and we are in the hostel, we should remain resourceful. We should stay connected. We should follow guidelines and have a self reflection on the things which are making us anxious and try to overcome those things. Stay calm and take necessary response. Give appropriate but limited and required response to the stimuli. For example, today you came to know that there is a lockdown. Get the resources, what you need to stay home. Don't rush to your native place because everybody is going to rush. There's going to be a mob at the railway station, which is going to leading to spread of infection. Stay at your place, remain resourceful, tell your family, I'm comfortable here, ask them to send, money or whatever. Be in touch with your friends nearby, maintain hygiene, do exercises at your place, take proper diet, do meditate, do yoga. So you can easily stay there for a week, 10 days, and then the lockdown is over. If you try to do, I have to go home, pack my bag and rush, no food, nothing, crowded place, you may catch infection, you may carry that infection home. There people may. So that is what happened during COVID times. Mostly it was the travelers. It is somebody traveling from China to Japan, Japan to China, in the ship, in the aeroplane, transmitting infection. Rather than being content at one place, staying put with resources, with guidelines, that would have helped. So that kind of approach, maybe in my opinion, it can be better.
Thank you, sir. One of the viewers have asked, can you suggest few exercises to boost our memory or something like that? which can boost our memory, or some exercise or some yogic practices?
Yeah, see, memory is something which depends upon our ability to recall facts and figures. To recall facts and figures is a science. You have to relate with the thing which you want to remember.
जी.
If you don't relate to it, you don't give enough attention and focus, then you tend to lose. Now in medical science, we have different ways to support the memory. Like, memory also should be taken as a process. Brain is also an organ, like, exercise we do for quadriceps or shoulder or knee. Similarly, there are exercises for brain also. You can do things like meditation is one thing, breathing exercises. Then you should have relationship with the thing which you want to remember. For example, you want to remember something about digestive system. So read about it, try to recall, try to read some case histories about it, try to see some patients about this, and then your memory is going to be permanent. Like in medical science, we say that if you see a case, then you are going to remember about it always. In physiotherapy, we go like that. Same is true with yoga.
Sir, one another question is there कि that आपके कई पेपर जो है वो कोविड के केस स्टडी या कोविड से रिलेटेड रहे हैं, तो आपका सर होलिस्टिक हेल्थ के बारे में ऐसा कुछ जो अनुभव रहा हो, अगर उसके बारे में अगर आप कुछ शेयर करना चाहें तो?
यस, मेरा जो मेनली यही है कि COVID-19 is a disease wherein holistic health is very important. From pure air to pure water. For example, how we drink water. If we have RO water, then RO water is devoid of minerals. One of the important mineral from which the RO water is devoid of is selenium. And then if we know that, then we have to replenish it. So if you are drinking RO water, look for those RO machines which are actually mineralizing the water. Then keep the water in earthen pot after RO filtration so that it has some mineral content, or keep it in copper vessels so it becomes charged up with, this is one aspect. Similarly, for food, diet, exercise, all these things holistically, if you will reflect, am I drinking correctly water? Am I eating correct food, balanced food? Am I doing exercises? Am I praying, meditating? Am I having good relationship with my peers? Am I energetically? So holistically, if you involve yourself, then you can easily take up this challenge. Another important thing is about, good diet. Diet has to be properly. We should, like, if somebody develops a COVID infection, then what should be the response? Now there are two extremes of responses. One extreme response is nothing has happened to me. I'm fit and fine. Fit and fine. I'll continue doing my work with the same vigor. That happened with many medical professionals. They have not taken adequate rest. They, in the line of duty, kept on working, and they had a poor outcome. Similarly, another extreme of this can be when somebody becomes very anxious and start rushing. People have, you would have seen a lot of crowds on the railway stations and bus stands. That was another extreme when people were having a lot of anxiety, which was not necessary. So we have to have a justified response. Whatever is required, whatever as per the guideline, I will do. But I will not kind of completely change my life and just that this is the end of the world. We should not think like that. Rather, we will take a judicious response we'll give to this. So that way we can respond better.
Yes, sir. सर, एक और प्रश्न है कि बहुत सारे लोगों को कोविड के बाद, रिकवर होने के बाद, बहुत सारी ऐसी एंजाइटी की या इस तरीके की भी शिकायत सुनने में आई. बहुत लोग कहते हैं कि अब सांस लेने में अभी भी उन लोगों को प्रॉब्लम होती है या दिल की धड़कन बढ़ जाती है. तो उसको मतलब रिकवर करने के लिए, उससे रिकवर करने के लिए क्या?
I think like your institute is the best place. You have Anulom Vilom Pranayam. and various other breathing exercises, relaxation techniques, yoga nidra for better sleep, and then you got this various asanas and pranayam, specifically anulom vilom and shavasana, and all those asanas are there. They can practice that. Meditation, mindfulness, this will all be good to overcome breathing difficulty. However, also do some activity according to the, sometimes we end up doing activities which are not, for example, if we are doing Surya Namaskar and you are doing Surya Namaskar in a closed AC environment, then you may not get the entire benefit. You should do Surya Namaskar when the sun is rising so that you get the adequate sunlight. Because with that there will be vitamin D synthesis and you will get the morning sun, which is in our ancient scriptures also, and modern medical science also has the same view that it has got multiple health benefits. So that is, I think, in my opinion, can be very beneficial.
ओके सर, थैंक यू सो मच. आपने होलिस्टिक हेल्थ के बारे में हमारे दर्शकों को इतनी अच्छी जानकारी दी. आप मोरारजी देसाई राष्ट्रीय योग संस्थान के इस प्लेटफॉर्म पे आप आए और हमारे सभी दर्शकों को इतनी अच्छी जानकारी देने के लिए मोरारजी देसाई राष्ट्रीय योग संस्थान की तरफ से और स्वयं अपनी तरफ से आपके प्रति मैं हार्दिक धन्यवाद ज्ञापित करती हूँ. साथ ही साथ मैं धन्यवाद देती हूँ संस्थान के संचार एवं प्रलेखन अधिकारी मोहम्मद तैयब आलम सर का भी, जो कि इस वेबिनार का हिस्सा बने, अपने व्यस्त कार्यक्रम में से हमारे लिए समय निकाला. और सबसे ज्यादा धन्यवाद मैं देना चाहूंगी हमारे संस्थान के निदेशक महोदय डॉक्टर ईश्वर बसवरेड्डी सर का, जिनकी प्रेरणा से ही ये जर्नी जो 2 अक्टूबर 2020 को शुरू हुई थी वो आज तक अनवरत रूप से जारी है. आप सभी का बहुत बहुत धन्यवाद तथा हमारे सभी दर्शकों का, हमारी तकनीकी टीम का बहुत बहुत धन्यवाद. और कार्यक्रम का समापन शांति पाठ के साथ करेंगे. ओम सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्, मा कश्चित् दुःखभाग् भवेत्. ओम शांति शांति शांति. बहुत बहुत धन्यवाद आप सभी का.